A life-saving HIV drug worked perfectly for years. Then, one day, something strange happened. A capsule failed a routine quality test. It did not dissolve properly. At first, it looked like a normal production problem. Maybe contamination. Maybe a bad batch. Maybe a machine setting was wrong. But it was not that simple. The drug was called Ritonavir. For many patients, it had helped turn HIV into a manageable condition. The chemistry was known. The process was controlled. The factory had made it successfully for years. But now the capsules were turning cloudy. Under the microscope, scientists found millions of tiny crystals. They looked like needles, and they were growing inside the medicine. At first, the team searched for a mistake. They checked the ingredients. They checked temperatures. They checked humidity, pressure, and every step of production. Nothing explained it. The strangest part was this. The crystals were still ritonavir. The molecule had not become something else. It had changed its solid form. This is called polymorphism. The same molecule can stack in different ways. Same atoms, same chemical identity, different crystal structure, and that structure can change everything. It can affect texture, stability, melting point, and solubility. For medicine, solubility is critical. If a drug does not dissolve, the body may not absorb it. Think about chocolate. A shiny, snappy chocolate bar can become dull and soft after it melts. The ingredients are the same, but the fat crystals inside have rearranged. Ritonavir had a similar problem. Only this time, the stakes were much higher. The new form was more stable, but it was also less soluble. That meant the medicine could stop working as expected. Then the problem spread. A small crystal can act like a seed. It gives other molecules a pattern to follow. Once the new form appeared, it helped create more of itself. Tiny particles could travel on surfaces, dust, equipment, or clothing. When production moved to another site, the failure followed. It behaved almost like an infection, but nothing was alive. It was chemistry. Eventually, Abbott could not reliably return to the original capsule form. They had to fall back on a liquid formulation. It worked, but it was not ideal. The crisis became one of the most famous warnings in pharmaceutical history. A medicine can look understood on paper, yet still hide another physical possibility. Today, scientists can revisit the case with modern tools. Crystal structure prediction can map possible solid forms before disaster strikes. Recent research suggests that Ritonavir's dangerous form 2 could have been predicted. Not perfectly, not without uncertainty, but clearly enough to raise concern. That matters, because a hidden crystal form can become a real-world crisis. The lesson is simple. In medicine, the smallest structures can create the biggest failures. A molecule is not only what it is made of, it also matters how it arranges itself. Ritonavir did not stop being Ritonavir. That was the frightening part. It stayed the same on paper, but changed enough to fail in the real world.